And hello, it's Kathy Frey here from IMCO, from the International Integrated Maternity Healthcare Organisation, and welcome along to this week's webinar. And a big warm return welcome to Julia. Say hello, Julia.
Hi, everyone.
Look, we are so rapt to have Julia back here again to do another topic, because she is such a bottomless pit of information, and so we've been able to really hone down on some topics for this audience. Now, so the topic today we're going to be talking about is, the assisting in that minefield of infertility, and we Dr. Julia Bartrop and myself and a group of other maternity health professionals, as an aside, volunteer on a forum called Ask the Maternity Gurus. And boy, this is one of our really common questions that comes through: advice on infertility. And I know that a lot of our birth practitioners here and our maternity healthcare providers don't always get involved in that area, because often by the time a person is needing your services, depending on what you do, they're already pregnant. But having that knowledge about assisting women to become pregnant is just so valuable, because even if we're not directly involved with that, we're often asked about it as maternity healthcare providers. So even though myself, say, as a midwife, I'm not dealing with women becoming pregnant, they're already pregnant when they need a midwife. But boy, are we asked about it. We sure, of course we are, because it's all part of that whole maternity picture. But just a little overview for those of you who perhaps haven't met Dr. Julia Bartrop before. She's a mum of two, and an acupuncturist and a Chinese herbal medicine practitioner. And her main areas of interest, are all around that preconception, fertility, pregnancy, birth, postnatal care, etc. And prior to studying Chinese medicine, Julia worked as a medical scientist. So that's a really great background to, bring together. It's so good to have that both sides of that knowledge of the East and the West. And also after surviving a car accident at the age of 19, that was what led Julia down the track of Chinese medicine. And so often, everybody has their stories that lead you to that passion that you follow. Now, just a little bit of housekeeping, just a reminder, we'd love for you to enter into the chat whereabouts in the world you are from and your role as a health professional, or maybe you're a wannabe mum-to-be, and you're dealing with infertility yourself. And also, feel free to ask any questions. Go into that Q&A section, and we'll absolutely make sure they get covered off. And the format today, before I hand over to Julia, is that she's got a PowerPoint slide presentation she's going to share with you, and so she's going to take over the screen for the next half an hour or so, but we'll make sure that any questions are ticked off before we wind up today. So welcome, Julia.
Thank you. Okay, let's share the screen and we'll get going. Okay, so infertility. How can we assist infertility with Chinese medicine? So as you can see, I've got two swans here in the form of a heart. So when we're actually dealing with infertility and coming from Chinese medicine, a lot of what we do actually focuses on emotions and coming from the heart. So in Western society, we're told pretty much to eat our emotions, but emotions actually play a huge role in the overall functioning of our body. and how our body is actually balanced as well. And now the swans in the perfect heart is that we need the heart and soul of both the male and the female to actually conceive and have conception, and which will therefore lead hopefully to a clinical pregnancy. And then I've just got a picture of our herbs, and you can see a moxa stick and some tea. So this is also where Chinese medicine comes in, is about nourishing the body, nourishing the mind, nourishing the body and the spirit. So when we're dealing with infertility, I was just talking to Kathy Frey, I could talk for ages. I've tried to make this as simplistic as possible, because when we're dealing with infertility, there's like this much information, and I'm just trying to make it really general today so that you get an idea. And Kathy and I were talking, we'll probably do more talks in the future. So, overview. What is infertility? The Western medicine view, and then how Chinese medicine can help and how Chinese medicine views infertility. So infertility, basically, when I first started, we were taught that a couple is infertile if they've actually been trying regularly to have to achieve a pregnancy, and they're having regular sex without contraception for 2 years. This has now changed, and it's now characterised by the failure to establish a pregnancy after 12 months of regular unprotected sexual intercourse. So here in Australia, a lot of the IVF clinics will say it's about 1 in 6 couples that are having issues. It's about 1 in 5 at the moment. And then with infertility, if you're over 35, your chances of getting pregnant each month actually reduce. So for those under 25, it's about 20% chance per month. Once you get to 35, it's about a 12% chance per month. So if a couple have been practicing having sex timing correctly for 6 months and there's no conception, it is advised that you go and see your GP or you go to your gynecologist and get further studies, because by the time you get to 35, that chance really is reduced. And then secondary infertility, which is becoming a huge thing. So secondary infertility is actually where a couple's already conceived a child, but they're trying for a second child and are not having much luck. So when we talk about infertility, there's a lot of factors that come into it. And at the moment, males account for 40% of all infertility cases, females 40%, 10% are due to both male and female. So the connection of male and female, there's abnormalities with the male, abnormalities with the female, or issues. And then 10% is defined as idiopathic, or infertility due to an unknown cause. So they've had all the tests, there's the ultrasound's fine, she's menstruating, her endometrial lining's fine, his sperm's all good, and there's no known cause. So this is where Chinese medicine actually comes in with the unknown causes, in that it's actually really profound. We can actually drill down, put our fertility investigation hats on, and actually have a look at what is going on. Okay, causes of fertility. Now, I'm just going to focus on females, but I don't want to forget about the males. But basically with males, a lot of it is due to sperm morphology, which has fallen a lot in the last 20 years, and motility as well. But as you can see here, causes of infertility for females, this is just some of it. I've just done a snapshot. When we talk about males, it's mainly sperm production, trauma to the testes, etc. So with females, so PCOS and endometriosis are up there. However, just because you've got PCOS or endometriosis does not mean that you are infertile. It means that there can be issues because you've got PCOS and endometriosis, meaning that it may be more difficult for you to actually have a baby. But it doesn't mean that you can't have a baby. A lot of GPs will actually tell women, you've got PCOS, you've got endo, you can't have children. That is completely wrong. And I just want to let everyone know that if you do have PCOS or endometriosis, it doesn't mean you can't have a baby. It just means that your journey might be a bit more difficult. So poor egg quality. So eggs basically begin to decline. New studies have shed from about 25 years of age. And by the time we get to 35 years of age, the quality of the eggs is what they call geriatric eggs. So there's more tendency to have more chromosomal abnormalities. There's more DNA effects within the eggs. So that's where the geriatric eggs actually comes in as well. If you're 35 and trying to get pregnant, they now call you a geriatric person and your eggs as being geriatric. Hormonal imbalances. So if your hormones are not balanced, basically what happens is your estrogen, your progesterone, your follicular stimulating hormone, which actually helps to grow the follicles, your luteinizing hormone can all be out. And that means that there can be issues with the cycle. So we need to have a regular cycle so that we can actually help to time sex. And we need to make sure that we're ovulating as well. So if we're not having, if our hormones are imbalanced, that can lead to problems with menstruation, with ovulation, and also with women not ovulating. So this is also coming into the irregular periods as well, being hormone imbalanced. It can also come into being iron deficient and just being too stressed and not having enough nutrients to actually have a period as well. A lot of women are doing a lot of exercise. They're really low in body fat. And they don't have that little lump of fat over their ovaries, which the ovaries actually need because that provides energy to them to actually ovulate once a month. So thyroid issues is really important because, again, this is an endocrine issue. If you have an imbalance between the hypothalamus, the pituitary, and the ovulation axis, which is affected by PCOS, endometriosis, and thyroid issues, then we have issues with fertility. Autoimmune disease, so your body's already full of inflammation and there's already a lot of other stuff going on, and that inflammation can affect fertility. Low body fat, so as I've said, with those women that are really athletic, training a lot, they haven't got that little lump of fat over the ovaries. We're not meant to have a washboard stomach. We're females, we're meant to have a little bit of body fat, and we need that body fat to actually nourish the ovaries. So sometimes just getting them to gain weight, like 2 to 3 kilos, they'll start getting their periods, their hormones will kick in, and we can start getting ovulation happening. So obesity, so this is actually the other way where we've got too much body fat, which affects hormones. So with obesity, sometimes even losing just 5 kilos can improve your fertility by as much as about 30%. So years on contraception. So this is a big one. A lot of teenagers will go on contraception around 13, 14. They don't want to have a period. They don't want to have to deal with it. They're on contraception for 20 years. Basically, what we've done is we've put our whole hormone system, endocrine system, into stasis. So what I mean by this is we're putting in synthetic hormones. So the body becomes reliant on these synthetic hormones. And when we have a period on the pill, it's not a proper period. It's a pseudo period. It's just that you're withdrawing that synthetic hormone to have a bleed. And then you start taking the hormones again. So it mimics the first month of pregnancy. And so when women have their period on the pill, it's not a proper period. It's not regular. It's not what their normal body cycles would be. So they come off years of contraception, and then we have to wake up the body. Some women can come off contraception, their body goes, yep, right, let's go back to it, and bang, they've got a period the next month. Other women, if they've been on contraception for about 13, 14 years, it could take up to a year before the body, the endocrine system, the pituitary gland, the hypothalamus, all of that functioning actually starts to wake up and to start producing its own hormones. And then this is where, when this happens, they can have a bleed, and then they might not have a period for 3 months. Then they can have a bleed, they might not have a period for 6 months. So we've got to basically balance hormones. We've got to get them having regular cycles. We've got to nourish them, and we've really got to balance out that hypothalamic pituitary ovarian axis, which is known as the HPO axis. And then we've got secondary infertility. So secondary infertility has been increasing in the last 10 years. And again, this is where a couple already have a child and they're trying for a second one, but they're having issues. So a lot of this can come into it. So there may be thyroid issues. They may just be too stressed. They may be sleep deprived. They may have irregular cycles. So it's all about actually combining all of this and balancing out the body. So a lot of dealing with infertility is not necessarily that the body can't make a baby or the couple can't make a baby. It's all about actually balancing the body down, balancing the body out, balancing hormones, balancing stress, balancing sleep, balancing life. And this is where Chinese medicine can actually come in and actually form a really great form of medicine and support for the couple. So whenever we're treating infertility, you don't just treat the male, you don't just treat the female, you're always treating the couple, because it takes two. It takes two to make a baby. And you'll see in one of my quotes coming up when we start talking about Chinese medicine. So Western medicine approach, a lot of the approach from Western medicine is with PCOS, so you put them on metformin. So metformin is to help to reduce the number of follicles if they're insulin resistant per month occurring in the ovary. So basically every month when we are ovulating, you will have a main follicle which is due to be ovulated that month. So that's like a primordial follicle. And then we have a whole heap of other follicles which the body actually collects. And then it takes them 12 months to actually become the primordial follicle. So your body's actually working on producing these other follicles. So you might have like 12 or 15, which is why we say, like, when we're looking at the primordial follicle, it actually takes women a year to produce an egg. With PCOS, they tend to produce a lot more follicles. So they might have 40 follicles a month. And then if they don't get ovulated, it causes bumps on the outside of the follicle. So think of an almond. And then what I want you to do is get sesame seeds or poppy seeds and just sprinkle it all on. So you'll have an almond, which is a lovely shape, and then you'll have all these bumps on it. So that's what a polycystic ovarian syndrome ovary looks like. And the metformin is there to actually try and reduce the amount of follicles coming in, and also with the insulin resistance, it means that their blood sugar is actually quite high all the time. And what happens is they start putting that away as body fat, which is where people with PCOS who are insulin resistant tend to be more weighty, more obese. And how they deal with that is with the metformin and also with diet and exercise. So surgery, especially for endometriosis, removing adhesions, removing scar tissue. With my girls that I work with endometriosis, I actually find that once they have that removal of adhesions or some of the endometrial tissue removed, their fertility actually does increase. So we will work with them. And then when I know a surgery is there, we'll support them, we'll nourish them. As soon as it's done, it's like we'll keep nourishing them, but it's like, okay, yeah, let's go. So medication for hormone imbalance, a lot of women are actually put on contraception to help with hormonal imbalance, which is not actually the right thing to do, because again, it's just the synthetic hormones. It's not balancing out their body. It's not working with their body to actually deep down and dig and find where that imbalance is coming from. So ART, which is assisted reproduction. So you've got intrauterine insemination, which is where they actually get the sperm and they inject it into the woman's fallopian tube. You've got IVF, which is, again, you get the egg, the sperm, they actually form the embryo and then you'll have an embryo transfer. Or you can look at getting a surrogate for those couples that do have issues. So they may not have a uterus, they may not have fallopian tubes, they may not have ovaries, or if it comes to sperm, there may be an issue with actually getting the sperm out. So again, this is where reproduction ART comes in. They can actually put a needle into the vas deferens and extract sperm and then do an IUI. So again, for men, medication, there's testosterone replacement. Again, this is synthetic hormones. It's not actually focusing on the underlying problem. It's all just like a Band-Aid. So they can do the wait and see approach. We'll just give it another 6 months, and in 6 months, you know, you're not pregnant, we'll have a look. Here, try these supplements, they should work. Let's just go to IVF. So some GPs and a lot of IVF practices now are saying, right, we need to have a look at lifestyle, we need to have a look at losing weight, we need to have a look at exercise. Some couples will go to the GP and the GP will just, not do any results or anything and just say, given your age, just go straight to IVF. That's not always necessarily the answer. Going straight to IVF is not always the answer because, again, you've got a lot of hormones which are being pumped in, you've got a lot of stress, you've got emotional stress, you've got financial stress. There's a whole heap of other stuff that goes with IVF. And the other thing is having a conversation now about when you want kids, because, ages ago, back in my mum's time, by the time they were 25, they'd probably already had 3 children. And egg quality and sperm quality are a lot better when we're younger. Whereas now 70% of women are having their first baby around 37 and males tend to be around 39. So there's this whole thing about the older population leading to a jump in infertility as well. So Chinese medicine and infertility. So I love this quote, and this is what I'm talking about when it comes to Chinese medicine. So this is taken from one of the ancient texts. When the man's essence is robust and the woman's menses are regular, then a child will appear. Now that sounds perfectly sensible to me. It means that a man is robust, his sperm is good, his testosterone is good, his hormones are balanced. A woman's period is regular, therefore they have sex, they can time sex, and a child will appear. So another quote is also, when the timing's right, a child will also appear. So this is bringing in that ancient Taoist philosophy that it's also to do with timing and the universe. And, when the cosmos deigns it to be the right time, the man's robust, woman's regular, and a child will appear. So again, this is, if you've listened to my talks on preconception care and everything, you will know that I go on and on about treating both male and female. And this is, it doesn't matter, whether it's preconception, whether they're going to IVF, it's always, it takes 2 to make a baby, and we need to treat both male and female. Okay, so in Chinese medicine, we always ask our 10 questions. So it will be, what environment do you live in? What's your diet like? What's your exercise? What's your stress? What's your sleep? Do you have any pain? For women, we're always drilling down, asking about, how old were you when you first got your period? Were they regular? Have you been on contraception? Are you on contraception now? If they're trying, how long have you been trying? Do you ovulate? Do you know that you ovulate? What are your periods like? How long do they go for? How often do you change your pads? You come in for a consultation with me and I spend 75 minutes with you. So about 45 minutes talking and then half an hour is treatment. So how do they know that they're timing right? Do they have cervical mucus? How's their sleep? How's their stress? What's their overall, lifestyle like? Do they exercise? What's their diet like? These are all really, really important questions to ask because all of this has a profound effect on our body. So if a man's coming in and I'm talking to him about fertility, I'm going to be asking, how's your libido? Do you wake up in the morning with an erection? Are you able to keep an erection? Are you really tired after sex? How often do you have sex? These are all really important questions, especially when it comes to fertility and infertility. Because most of the time when people come to see me, it's not just for preconception care. It's like they're already down the road of going into IVF, or they're looking at IVF, or they're in IVF already and they're looking for further support. So the role that Chinese medicine plays, it's an amazing medicine and it has a lot more of a profound effect on the body than a lot of people know. And the fact is some women can come in not having had cycles for ages and it may take 3 to 6 treatments and we can start getting them to have a bleed because the acupuncture works on the brain. It works on that hypothalamus pituitary ovarian axis. It wakes up hormones, it wakes up organs in the body. We can relax the body, we can let it know it's safe, we can help to assist with stress, we can help to balance out emotions. And the fact is they're coming into a warm environment, a warm, nurturing environment, and they've got someone to listen. So a lot of women that are having fertility issues and go to IVF, come into my clinic, and they walk into the room and they just go, oh. Number one, it's a safe environment. It's not white, it's not clinical. A lot of them, as soon as they walk into the IVF clinic, it's all very clinical. There's no bedside manner. They're like, I just love coming here because I just feel safe and I can just relax. So it's really important that we're able to relax the body, that we're able to decrease stress. But when we're treating, we're always treating from the heart. And this is where our soul is. And in Chinese medicine, there is a heart-kidney connection, which parallels the hypothalamic pituitary axis. So with a lot of men and a lot of women, there is a heart-kidney imbalance or disharmony, or if you think of the pathway, so you've got one going up, one going down, this can be blocked. So a lot of our treatments with infertility is about reconnecting that heart-kidney pathway and connecting those emotions and connecting them to their cells, making them feel safe, making them feel secure, because a lot of people will hold emotions in and block that pathway as well. And we find that once we actually reconnect that pathway, fertility starts to flow, so that the menses will start to be more regular. For men, they'll find that their libido kicks up, they're feeling more desire to have sex, their erections are much better, they can, perform a lot longer. So it's really important for anybody, but yeah, from Chinese medicine as well, that we treat from the heart, and that we're always focusing on emotions. So I have got a big slide about that as well. So infertility or subfertility. So TCM sees infertility as the body being subfertile. So it's not that it's infertile unless we have a look at the 5 clauses where they're seeing infertility mainly as being an abnormality. So in the male, the absence of a vas deferens, or the absence of sperm being able to exit the body. So he's not actually to ejaculate sperm, which means if you can't do that, you can't actually make a child. For women, if we look at abnormalities, we're looking at sometimes having a bifurcated uterus, a cornated uterus, which can not necessarily lead to the longevity of a pregnancy, which may have 2 uteruses. There may be no fallopian tubes, there may be no ovaries, or the patency of the tubes might be blocked. So when I have a look at the ancient text, it was all talking about infertility as being abnormalities which were preventing them from actually conceiving naturally. And then it goes on to talk about adoption. So, they can actually have a family by adopting children. So when we have clients come in, I don't like to say you're infertile. I like this subfertility. Your body is not there yet. We need to balance out the body. We need to tweak a few things and nourish you, release a few things, and then we can get your body functioning back up to its optimal state, and you will be in a fertile state. So all of our bodies always has the chance to be fertile, given the right circumstances. So again, talking about thyroid issues, so if you've got an overactive thyroid or an underactive thyroid, this can all lead to fertility problems, because it leads to that hypothalamic pituitary ovarian axis imbalance, which in TCM relates to heart and kidney disharmony. So it's always about balancing out those thyroid hormones, maybe, and then if they're underweight, getting them to gain weight. If they're overweight, reducing that weight. So we're coming at it from a holistic approach as well. With PCOS, so you've got your 2 women with PCOS. So you've got those that are insulin resistant, so they tend to be more weighty, and then you've got those that are really skinny. And here, again, it's about balancing out the hormones. It's treating from a Chinese medicine pattern. So people will come in and say, I've got PCOS. In Chinese medicine, there can be 5 different patterns for women with PCOS. So we're never just doing the one treatment for anyone with PCOS. It's always based on the individual's pattern. Endometriosis. So we see this as stuck blood in Chinese medicine. So endometriosis, we're going to be moving blood. We're going to be breaking down blood. We're going to be focusing on reducing pain as well and regulating the cycle, as with PCOS. So PCOS clients can come in and some can be having irregular periods, some may not be having periods. So again, it's all about waking up the body, balancing those hormones so that for them, they're having a regular cycle. So we do like the cycle to be around 28 to 35 days. Anything over 35 days is called a long cycle. Anything less than 21 days is a short cycle. And again, with that, we've got hormonal imbalances. So it all comes down to balancing hormones. With some of them, if someone's really iron deficient as well, there's not enough blood to have a bleed, which can lead to irregular periods. So we're going to be focusing on building up blood, building up their bodies so that they've got enough blood to actually enable the body to let go of that blood to have a period to regulate a cycle so that we can conceive. And then again, with men, you've got sperm issues, but that will have to be another topic because I can go on and on about this for ages. So subfertility, infertility. This is where TCM has an important role to play, because we're not just treating symptoms. We actually want to dig down and delve into the root cause. So the root cause may be that they're deficient. There's not enough blood. There's not enough energy. Therefore, their body is not having a period because it hasn't got the reserves to release it. It could be that they're too stressed. They're too stuck. And we need to actually reduce stress to help the hormones become balanced and to let the body know that it's safe to reproduce. So I've got some slides further on and we'll have a look at stress in the body. For men, it could be that there's a fear of being a father, which is actually preventing, the sperm from being produced right, or the motility of the sperm. So acupuncture and Chinese herbal medicine have a profound effect on the brain and nervous system. So the studies that have been done, you put an acupuncture needle in, they've done MRIs, CAT scans, the brain lights up. It actually has a direct effect on increasing blood flow, on increasing oxygen, and on releasing hormones from the brain and releasing serotonin and dopamine, which actually helps the body to relax. So therefore, we're counteracting the effects of stress. Emotions and fertility. Now, this is a really, really big one, and Western medicine doesn't delve deep enough into it. So in Chinese medicine, we have what we call the 5 emotions, okay? So this is joy, over worry, irritability, anger, fear, and sadness. So a lot of people, some people are not taught how to deal with their emotions. If we're, as a child, we're having a meltdown and our parents just let us do that, it's okay because we're actually releasing those emotions, we're getting it out, and then, our body's like, oh, that feels better now. I'm back in balance. I've released what was blocking me, what was keeping me stuck. So every organ actually has an emotion associated with it. So the heart and the kidney, as I said, are linked to the HPO axis, and this is associated with sadness, anxiety, and fear. So the liver is irritability, anger, and frustration. Spleen is that over worrying, overthinking, ruminating on things. You get stuck in a thought and it just goes round and round and round. So when that emotion happens, it starts draining the organ. Once we start draining the organ, we have a backlog. It starts draining your other organs, which leads to depletion in the body. So you can say this person might be coming in with heart palpitations, which is a deficiency of the heart, anxiety, again, related to the heart, fatigue, and digestion issues. And then when trying to conceive, if month after month after month after month, you're not getting a positive result, this these emotions of sadness and anxiety and fear around, are we ever going to have a baby? When's it going to happen? You know, it's not happening. What's wrong with me? All sort of causes rumination and a big backlog as well. So we've got all of these emotions, and these emotions can lead to menstrual irregularities. It can lead to anovulation, which is where the woman's not actually ovulating, and it can lead to uterine and tubal dysfunction as well. From a Chinese medicine point of view, this is all from a Chinese medicine point of view. And then having that constant stress and that constant anxiety affects that HPO axis, which affects our hormones and that balance. And then again, that heart and kidney pathway. So if that becomes blocked, that's actually one of the main pathways which helps with fertility. Then we can have issues with getting pregnant. So fertility in women. So when women come in to see me, it's like, okay, well, what's the main cause? So when they come in to see me, they get a 16-page questionnaire. So this is covering everything. From diet to stress to exercise to their menstrual period. Questions about their menstrual period goes for 5 pages. I want to know everything. I want to know everything about the uterus organ, about their bleeding, about their cycles. I want to know if they've had blood tests. I want to know if they've got a diagnosis. Do they have PCOS? Do they have endo? Is there a history of pelvic congestion or pelvic inflammatory disease? How old are they? How long have they been trying for? What's their stress level like? Because stress is a main cause of not being able to get pregnant. It causes so many disruptions within the body that if they're in a constant state of stress, their body's not going to be able to reproduce, because we're in a constant state of stress where we're running from a tiger. We're running from danger. And if we're running from danger, our body is not primed to reproduce. It's primed for survival. It's not thinking about, you know, progeny. How's their sleep? So sleep and stress go hand in hand. If you're getting to sleep, if you're a shift worker and you're not getting to sleep till after 12, that actually affects your hormones as well. And your body will actually have an increased level of cortisol and adrenaline within the body. And these actually affect reproduction as well. They basically put a halt on it. And increases in cortisol can lead to increases in weight gain as well, so you get that compounding issue going on. We're always looking to improve egg quality. So this can be done with acupuncture, it can be done with herbs, it can be done with supplements, and it can be done with diet. And just because a person's 35 doesn't mean that their egg quality is automatically poor, as Western society says. It just means that we're focusing more on improving that egg quality. So like I said, for a female, it takes us a year to actually develop a primordial follicle that's going to be ovulated once a month. So, you know, all the ones that are at the back after that ovulation, we're focusing on building up their egg quality so that we have a really good egg ready for ovulation. And then we also go into lifestyle advice. So do they need to lose weight? Do they need to gain weight? Do we need to focus on stress calming? Do we need to bring in some mindfulness? Do they need to stop exercising? Are they doing too much exercise? Do we need to look at, instead of going to HIIT 5 times a week and doing triathlons, to you know, more gentle exercise such as yoga and qigong and walking? So there's a whole lot that goes on, and basically when we are dealing with fertility, the other thing that's really interesting is I have had a client who's come in, and from the age of 5, she's like, I don't want children, I don't want children, I don't want children, I don't want children. She came in and her cycles were irregular, so she might have one 3 months and then 9 months, and she wasn't having a regular cycle, and the question of children had come up, and she's like, well, I don't really have a regular cycle, I should come in. And her dad's comment was, of course your cycles are irregular. You've said from 5 years old you don't want children. So she's programmed her body to say, I don't want children. So her body is responding to what she's actually thinking. It's like, so do be careful with clients for fertility about what they're saying to themselves, because the body listens. The body listens. So if you say, I can't have children, the body goes, oh, okay, yeah, I can't. Whereas if you're like, if they're talking to themselves and they're saying, I'm working on myself, I'm balancing my body, we can have children, I'm nourishing my body, I'm looking after you, we get a different response. So with some of my girls, I'll get them in the mirror and I'll get them talking to themselves. So the eyes are the window to the soul. So we get them talking to their soul, we get them talking to their body. It might sound stupid, and I know a lot of them feel stupid, but after doing it for a couple of weeks, they're like, oh, this is actually really good. I never actually have a conversation with myself. So it's another pathway to getting to explore yourself and getting to know yourself and being comfortable with who you are as well. So this is more like spiritualistic, Taoist, Daoist, Chinese medicine that we're getting into there. So what to do with infertility as an issue? So if you've looked at my preconception care, you'll know that this is all through, but this is a checklist of what I want to see when people are coming in for their first appointment, especially if they've been trying for a little while. I put my little fertility detective hat on, and it's like, I want to tick off and make sure that all of this has been investigated, because some things can fall through the cracks, and it might just be, oh, they haven't done this test. And, you know, you get that test back and it's like, oh, okay, yep, right, I know what we're doing now. Because all of this actually affects how I'm treating and how we're working with the couple as well. And, you know, how long it might be that they need to see me before we say, yes, okay, go to IVF, or, okay, start trying now. But again, a lot of it is regulating the woman's period and working with the male and improving sperm. So blood tests. We want a full blood count. We want urine electrolytes. We want that thyroid function test for both male and female. It's really, really important. Vitamin D. So many people at the moment are low in vitamin D. Vitamin D actually affects mood. It affects hormones. It affects bone health. It's really, really important. So homeocysteine is just giving us a clue as to inflammation levels, what's going on in the body. There's inflammation, we need to clear it, because the body doesn't like inflammation when getting pregnant. We want the hormone panel. We want to see a male panel and we want to see the female panel. Sperm test for males. If you don't have a sperm test, you're not treating fertility. This is a must. I say to all my couples, I need to see a sperm test. It may take me 9 or 12 weeks, hammering on every week. Have you done your sperm test? Have you done your sperm test? But I'll get it. You can't treat fertility without knowing what the male sperm is like. You just can't. You're treating half an egg. Like you're basically treating a broken egg. For women, are their periods? Their periods, are they regular? When are you timing sex? How do you know that you're ovulating? So a lot of women will come and say, I've got ovulation pain. It's like, well, tell me about your mucus. You know, how long is your cycle? When do you start having sex? Are you just having sex around ovulation? Because, you know, for some women that might work, for other women, you know, not so much. Their stress levels, their sleep. How is their stress? Again, if it's high, it's going to block that hormone pattern. We're in that state of adrenaline. We're running away from a tiger. All of the blood flow is going to the arms and legs. Your digestion gets switched off and your reproductive system gets switched off. Your body goes into survival. If they're in constant high stress, they're not going to be able to reproduce until we actually let the body know that it's safe to. Sleep, if they're not getting 8 hours of sleep a night, this also affects hormones, increases cortisol, and basically turns off that reproductive system as well. So the other thing is, if they've been trying for a while, seek assistance as soon as possible. Go to your allied health practitioner, your GP, your gynecologist. So again, this is like having that knowledge of, you know, when is it too long? So for 35-year-olds, it's 6 months of trying to get pregnant without conception. And for those that are younger than 35, it's now 12 months. Okay, stress, the symptoms of stress. So stress is a major factor in fertility, okay? And basically when we are in a constant state of stress, our whole body is on high alert. We're running away from that tiger. Adrenaline is increased. Blood flow is always increased to the arms and the limbs, ready to run away. You haven't got much blood flow going to your brain because your body's in survival mode. It's focusing on concentrating from running away from the danger. So these are just some of the symptoms of stress. So you can have trouble concentrating, headaches, anxiety, anger, digestion problems. Digestion problems is a big issue. And this also leads on to fertility. If we're having digestion problems, we're not getting enough nutrition, then we haven't got enough nutrition to actually support the body and to support the reproductive organs and to have enough blood to have a period as well. So this is actually where, when we're stressed, we can start missing periods, we can stop ovulating. Fatigue is a huge one. Basically, again, like with the digestive problems, we haven't got enough nutrition coming in, or we've got too much adrenaline going through our body and we're not having that chance to rest, that we're constantly using up energy. So decreased sex drive. This is just, you know, that body shutting down that reproduction as well. Skin irritations, so more rashes, more pimples, more redness to the skin, muscle tension, body aches and pains, teeth grinding is a really popular one, apathy, I just can't do it, and trouble concentrating is a huge one. So if my clients have got like 3 out of these 10, I'm like, where's stress? And they might say, oh, well, you know, it's a 5. So with Chinese medicine, I can feel the pulse. If the pulse for me is taut and wiry, it indicates that their body's in a state of stress. So they might not recognize that they're stressed because they've been in this state for so long that it's just become the normal for them. So basically, we're always going to be concentrating on reducing that stress, on relaxing them with our treatments and also with our Chinese herbal medicine and diet advice. And this is where the exercise and mindfulness also comes in. So I will get people at traffic lights, I will get them to put a post-it on, breathe, or, you know, so getting them focused on breathing to get them out of that stressful state and relaxing and working on that vagal nerve as well. So stress, don't discount it. So stress increases cortisol and adrenaline in the body, and this actually leads to an decrease in sex drive and reproduction because we're affecting that hypothalamic pituitary ovarian axis. So it's actually blocking those hormones from being released, which affects the whole cycle and can lead to blocking ovulation as well. So it decreases the production of dopamine, serotonin, which are your happy hormones. And long-term stress, you can go into adrenal fatigue. So basically what happens there is your body's secreting adrenaline every day. And now we have a little adrenal gland, which sits above our kidneys. So in Chinese medicine, this is where the kidney comes in as well. And the emotion is fear. And it's completely... So it's releasing adrenaline. If you think of this gland, like after, you know, releasing so much adrenaline, it starts shrinking and becoming like a shriveled up sultana. You're releasing adrenaline and releasing adrenaline. It doesn't get a break. And basically this is where that whole cycle of stress comes from. We need to actually switch that off, cut it off, and then enable the body to release what we call noradrenaline, which is relaxing and just switching off that production of cortisol and adrenaline in the body so that our body stops going from a state of fight or flight or stress into a more relaxed state. So stress affects sleep. There's a direct correlation between being stressed and having poor sleep, not being able to get to sleep, or having a really light sleep and not enough deep sleep. So reducing stress can improve sleep, but here is where I will bring in, make sure you soak your feet in magnesium, make sure we're taking magnesium, have chamomile tea, which is sedating and calming. So stress, long-term when we're looking at reproduction, leads to a decrease in fertility, leads to decrease in libido, affects egg quality, affects sperm production, and affects hormone production. And again, to help combat stress, we need 8 hours of sleep to actually help the body to rejuvenate and to repair itself, and also to aid with reproduction as well. So how can we help? Okay, we're going to focus on decreasing stress. So for some people, this might be by exercise. It could be by journaling. It could be by getting them to be more mindful, so breathing techniques, or getting them into yoga or stretching, or being more social, getting them into a book club, which, you know, during the pandemic has not been that easy. Again, trying to make sure that sleep quality is really good, that we're getting 8 hours of sleep, and that we're reducing those cortisol and adrenaline levels. Supplements. So we can help with supporting egg quality with supplements. We can help with egg quality with magnesium as well. And then with Chinese herbal medicine, we're going to focus on building and nourishing the body and making sure that the energy of the body is flowing freely. So because with stress, that energy actually gets stuck. It's like we're caught in a traffic jam. So we're going on a freeway at 100. We get stuck in a traffic jam, we got stop, start, stop, start, stop, start. We then get to a place where we can go free, we got 100, and then we come to a traffic jam, we've got to slam on the brakes again. Basically, this is what stress does to our body. So it's like, yeah, I'm hurning along, I'm going at 100 kilometers, bang. So this is the impact that stress has on the body. Again, calming the mind, yoga, qigong, breathwork, diet. So the fertility diet, so focusing on clean eating, lots of fruits, lots of veggies, lots of good fats. We need good fat for hormones and to build hormones. And we also need those omega-3s, omega-6s, 9s. Making sure that they're not drinking alcohol, and that if they are having coffee, it's one good coffee a week, because caffeine does affect fertility as well. So again, always support. So you need to support the body to be able to deal with stress. You need to support the body to be able to wake up hormones, support the body to make blood and energy. So blood and energy basically are our essence, our nutrients, our vitality. And if these are low, we're not going to be able to have enough energy to actually procreate and make another life. Always support the heart and Shen. So again, this is coming to balancing emotions, which is therefore balancing the rest of the body, and treating the underlying causes. So there might be trauma, or there could be beliefs about themselves or beliefs about their family, which is actually blocking fertility as well. So helping them to come to terms with that and releasing that, but in a nurturing and gentle way. So you're not forcing them, you're just working with the client, and going along with their journey and allowing themselves to unravel and release as we go. Provide a safe place. Listen. The couple will tell you what's wrong. They might not tell you in so many words, but by listening and having a look at their body language and having a look at what's going on in their body, we can generally drill down and find what the issue is. And then it's just a matter of unlocking that, or nourishing that, or nurturing that, or releasing that, in able to get their body from subfertility into a fertile state. Okay, so eggs, supplements. So what can we do to improve egg quality? What can we do to help support our bodies when women are trying to get pregnant? So eggs like antioxidants, so vitamin C, vitamin E, vitamin D, beta carotene, zinc, selenium, magnesium, CoQ10. Super antioxidants is the OPC, which comes from like grapeseed oil, is actually really, really good, and super mushroom powders are really good. We want high quality essential fatty acids. So you want to be having flaxseed, linseed oil, deep sea fish oils, cold pressed olive oils, again, omega-3, 6 from avocados, nuts and seeds. You want to focus on making sure that they're getting 8 hours of sleep, because sleep is actually where our body repairs itself, where we make blood, where we make new cells, where we repair DNA, take out the old blood cells, make new blood cells. Inositol for those with PCOS, so especially for insulin resistant PCOS clients. So this actually improves egg quality and improves insulin resistance as well. So decreases blood sugar levels, but really improves egg quality. And we're looking at taking inositol for about 6 months. And that's when we start seeing an increase in egg quality, And this also helps with keeping weight down as well, and a lot of those other issues with acne. And then you want to make sure that they're on a good women's multi as well, and this needs to include iron. So some of the multis at the moment are taking iron out, which is not good, because in pregnancy we actually require a lot more iron. And when we get pregnant, baby sucks a lot of the iron out. So we need to make sure that it has iron on. I actually use Naturabest. I know that's available in New Zealand and through a lot of more countries at the moment. So they're just some supplements that eggs like, but obviously you're going to be treating the female according to what's going on, but do make sure that she is taking a good quality preconception formula, and the male must be taking a male multi as well. So in summary, and you can see I've got my gorgeous little heart here, we're going to treat the root cause. So what is the underlying cause of disharmony, imbalance in the body, which is making the body subfertile? So I don't like saying infertile. Relieve stress, treat the heart, treat the shen, treat the soul, reconnect that heart and uterus, kidney axis. We will treat with Chinese medicine using herbs, acupuncture, acupressure. They'll always have a treatment plan when they come to see me. They always know where they're going, and we'll always check in with them. You want to nourish them, you want to nurture them, you want to empower them, and you want to educate them. So my takeaway from this is that acupuncture and Chinese medicine, it's an ancient system. It's been used for so long, and it has a profound effect on the body, and it happens really, really quickly. And it has an amazing way of reconnecting the mind, the body, and the spirit to get everything in harmony, to enable the body to actually balance itself out, and then just let the body get on with what it needs to do. If people are having real issues, and they might not be able to come to terms with not having a family or where to go next, I also recommend my clients go and see a perinatal counsellor, and they can just come up with different ways that they might be able to go ahead or backwards, or, you know, just give them space to actually release their emotions and grief and what might happen if they can't have a family naturally, but, you know, they might then look into adoption or being foster parents or something like that. So as much as we're dealing with infertility, we're also wanting to give them a pathway forward and options as well, so that they've always got options around them. Yeah, so that pretty much concludes my talk. So you can contact me at rebalancedtcm@gmail.com. You can have a look at my website. So I've got a lot more information about PCOS and endometriosis and regulating the cycle on my website. You can follow me on Facebook, Instagram. I'm happy to do telehealth appointments from anywhere in the world, and I'm happy to assist with cases. So if you guys have got issues and want to ask me questions, I know a lot of other acupuncturists have reached out after my talks, and we've actually had some really good outcomes. So yeah, that concludes my talk today, and we've sort of done a delve in, but I've tried to keep it very general. So I hope you've enjoyed it.
Oh, Julia, so great. You know, you always fill the webinars with so much really useful, practical information. And we do need to wind it up because we're, you know, heading over time, and I know there's so much more you could share. And, you know, we probably will do a, you know, advanced version of this topic in the future. I really love how you, you know, differentiate between saying whether, you know, fertility, you know, or infertility versus subfertility. And that's something that does seem to get kind of forgotten about today, that we're not talking about, in most cases, we're not talking about infertility, we're talking about subfertility. I thought I'd just ask you one sort of question towards the end here, and that is, if there was like, what would you say would be the commonest issues that cause female subfertility that the woman herself can fix? I'm just wondering, you know, is the certainly I know of infertility obstetricians who will say their commonest issue that they deal with is a BMI that's too high. But is there, what, in your opinion, what would be the commonest thing that women can just fix themselves? That's, you just see it all the time. It might be stress, it might be because they're too skinny, it might be because they're too overweight. What would be the commonest things that are so fixable?
A lot of it comes down to stress.
Right.
Stress and irregular cycles and iron deficiency.
Right. Okay. That's very cool. So stress is something that needs to be managed. Iron deficiency can be dealt with supplements. And so it's almost like those are perhaps in a way before women start investing big chunky money into infertility programs, etc. Maybe the first thing that they need to just be doing is knowing that their weight is on track, knowing that their stress is getting managed, and knowing that they've got good iron stores and they're taking a good daily supplement. You know, that's like, start there at least. Do you think, especially when in countries where funds are tight and there's not always, you know, insurance or government welfare situations that can cover women getting assistance with subfertility.
So I guess the other thing that I'd say is talking and planning when you want a baby as well, because then you know, right, we need to stop contraception. I need to give myself 12 months for the body to get back into balance. Right. So it's actually even further back.
Yeah, understand. Instead of that situation of, oh, I came off the pill, 3 months ago and I'm still not pregnant. Why is this happening? And it's like planning in advance. And saying, right, I will come off, and maybe if you don't want to be pregnant straight away, use barrier devices, but get yourself off the hormonal contraception 12 months earlier than you're thinking you want to start to conceive. Yeah.
Because this is the problem. If people have been on the pill or they've had implant in for 5 years, they don't realize that it's not their body producing the hormones. It's actually the synthetic hormones, and that it can take your body up to 12 months to actually sort of start producing its own hormones.
Absolutely. And I think there's also this general misunderstanding that when women are on hormone-based contraception, that somehow they're still ovulating and things are still functioning, but they somehow don't get pregnant. And of course, that's not what happens. You stop ovulating.
Yes.
So, if you're going to have your body for 10 years on the pill and it's not ovulating, why on earth would you expect it to suddenly just crank on up and be functioning? It takes, So I think a lot of women don't realize that they are not ovulating because they often are still menstruating. So they think that they still have a cycle, but it's not a proper cycle. It's like a pseudo cycle, isn't it?
So that's what I said. It's a pseudo cycle because it's actually withdrawal of the hormones that causes them to bleed. So while they're on those sugar pills. So
they're not menstruating because they've ovulated and if egg didn't fertilize. That's not the cause of the menstruation. Which is why we should usually menstruate, is because we ovulated, the egg didn't implant, it didn't become fertilized, it didn't implant, so we menstruate. That's why we should, but of course, anyway. But I think there is a lot of times when women, after a first baby, I've seen it a lot, where they will really hesitate to go back onto hormone-based contraception after a first baby, because they've realized that was stopping them ovulating and they hadn't fully appreciated that before. So there seems to be a lot of hesitancy to go back onto hormone-based contraception. Often seen that it's almost like they appreciate their ovulation more, and they don't want to stop that. They just want to put a barrier up between the sperm and their egg.
I think, Kathy, what it comes down to is educating the teenage women and everything about their cycle and what contraception does. Like, yes, it's there, but you know, what is it actually doing to my body, so that in the years coming up to when they might decide they want a family, they're aware of, you know, choices with contraception, etc.
Yes, I totally agree. I think it's just the whole kind of, you know, let's go down and get the pill, and without appreciating what that's going to be doing when they've been on it for a very long time. But anyway, look, it's just so great to have you here. We must round it up, and so thank you so much again, Julia, and thank you for those that were here live today. It's always great to have the live audience, and we look forward to catching up with everybody again next week and beyond. Bye, everybody. Thank you, Julia.
Bye.